All right, let's jump right into this explainer. If you've ever felt like you're drowning in a literal alphabet soup of healthcare acronyms, HIS, EHR, CMIO, CI, trust me, you are absolutely not alone. Today, we're going to build a mental filing cabinet for all this dense terminology. We'll decode the main concepts forming the digital backbone of healthcare, translating that heavy technical jargon into, well, something that actually makes sense. Here's a quick roadmap of what we're covering. First, decoding health information systems. Second, the core HIS model. Third, people, process, and governance. Fourth, analytics, BI, and CI. And finally, shifting to value-based care.
Section 1. Decoding health information systems.
Okay, so when we hear the term health information systems, or HIS, it's really easy to just picture a bunch of computers or a dusty server room. But the crucial takeaway here is that HIS is an entire living ecosystem. It's the end-user devices, like the tablets the nurses are carrying around. It's the networks connecting different hospitals. It's the underlying processes. And maybe most importantly, it's the vital data generated every single time a patient gets care. It is literally the complete technological infrastructure keeping modern healthcare afloat. Section 2, the core HIS model. Now, think of the HIS model as our structural anchor for all this jargon. It's basically a series of concentric layers. At the very core, you've got foundational technology. That tech feeds outward into systems and management, which then empowers the people and processes to generate data. And ultimately, that data ripples out to shape global health policy and research. It's a total progression from the inside out. And you really have to notice how this ecosystem builds sequentially. Like, there's just no way you can have advanced artificial intelligence or do groundbreaking public health research without first laying down that rock-solid foundational technology. You build the base, you use it to redesign workflows, which, as we'll see, is called informatics, then you analyze the data, and then you get that global impact. None of those outer, flashy layers can exist without the core.
Section 3. People, process, and governance.
All right, this brings us to a super important piece of the lexicon, health informatics. What does an informaticist actually do? Well, informatics is the intersection of computers and human workflow. It's all about enhancing systems to fundamentally improve how the work gets done. For instance, if a nursing informaticist completely redesigns a software alert so that it reduces medication errors on the floor, boom, that's informatics in action. It's finding the real meaning in the data to make care better. Now, who leads all this? Decoding this specific leadership alphabet soup is actually pretty fascinating. You need distinct, specialized voices. You've got the CIO, the Chief Information Officer, steering the big picture IT strategy. But then you have the CMIO and CNIO, the Chief Medical and Chief Nursing Informatics Officers. These are actual doctors and nurses, translating real clinical needs into IT architecture. Throw in SMEs or subject matter experts to guide specific tasks, and you've got a team where medicine, nursing, and IT are finally speaking the same language. Of course, all these leaders constantly run into our next term, the Change Management Board, or CMB. Let's be real. Modifying a live, in-production hospital software system is incredibly disruptive and, frankly, super stressful. So the CMB steps in as the ultimate gatekeeper. If you want to update software that doctors are using right now, the CMB has to review and approve it. They are there to protect the hospital from excessive downtime and total chaos. And taking a step back, the CMB and all these tech leaders fall under the broader umbrella of HIS governance. Governance is essentially the discipline and self-control of the whole organization. It's about being good stewards of precious resources, protecting against risk, and setting the ground rules. Basically, governance ensures that the millions of dollars poured into technology actually align with the hospital's true mission, treating patients safely.
Section 4. Analytics, BI, and CI.
Moving right along into the analytics layer of our model. This is where things get really exciting because we finally start harvesting the fruits of our labor. All that foundational tech and process design we just talked about, this is where it pays off. Let's kick this off with business intelligence, or BI. Now, BI is a pretty generic industry-wide term. It's all the methodologies and architectures that transform raw data into useful information. In a hospital setting, BI usually looks at the big picture, things like overall financial transactions, supply chain efficiency, basically asking how well is the overarching business running. But, and this is a big but, in healthcare, we have to distinguish BI from CI, or clinical intelligence. While BI is looking at finances and operations, CI is laser-focused on leveraging clinical data to actually drive health outcomes.
CI transforms raw numbers into health KPIs, like readmission rates or infection alerts. It's the longitudinal tracking of a patient's care. In short, CI is how we use data to make people healthier.
So, where does all this data live? To make clinical intelligence a reality, hospitals use central data repositories, or CDRs. You'll also hear them called data warehouses. Think of a CDR as a massive storage unit. It pulls replicated information from dozens of isolated systems, the pharmacy, the lab, the billing department, and dumps it all into one integrated location. This means analysts can finally extract the data and see the complete story of a patient's journey.
Section 5, shifting to value-based care.
Okay, so why does all this jargon, informatics, governance, data warehouses, why does it matter so much right now? Well, it's being driven by a massive financial shift in the industry. For decades, healthcare ran on fee-for-service. This is exactly what it sounds like. Insurance pays providers strictly per service or procedure provided. Our early digital systems were built purely to support this type of billing, but there's a huge flaw here. It inadvertently incentivizes maximizing the volume of medical services, rather than focusing on whether the patient actually got better. Now, the industry is shifting toward value-based care, which completely flips the script. Instead of volume, value-based care financially rewards providers who improve clinical outcomes, reduce overall costs, and keep populations healthy. It moves the goalpost from how many MRIs did we do to how effectively did we manage this patient's chronic illness. It is a total game changer. And here's the connection. To actually achieve value-based care, you absolutely cannot rely on clunky, silo technology. Providers need that advanced clinical intelligence and those foundational HIS layers we've been decoding today. Networks like accountable care organizations, or ACOs, and programs like Medicare Advantage, they depend entirely on timely, intelligent data to proactively manage entire populations. Simply put, without robust informatics and data warehouses, value-based care just isn't happening. So we've decoded the core lexicon and built our foundation. But as we look to the future, I want to leave you with a provocative question. As the next wave of artificial intelligence continues to evolve, how is it going to rewrite this entire alphabet soup? How will machine learning redefine clinical intelligence and accelerate the shift to value-based care in the coming decade? The foundation is there, but the systems are always evolving. Keep asking questions, and thanks for exploring this with us.